What's going on, everybody? My name is Braden Reeves and I'm a physical therapist assistant at the Meharry Clinic in Nashville, here to teach you how to use your TENS unit. The TENS part of TENS unit stands for transcutaneous electrical nerve stimulator, and the purpose of the TENS unit is to send electrical pulses through the skin to stimulate your body's own painkillers. Your TENS unit may be used to help with many types of chronic pain, such as arthritis, muscle pain, neuropathic pain, back and neck pain, and so much more. If you have a cardiac pacemaker, defibrillator, spinal cord stimulator, or any implanted electronic device, you should not use the TENS unit as it can cause disruption of these implants and devices. Do not place electrodes on your head or carotid sinus located at the side of your neck or on your eyes. If you feel any type of skin irritation, especially after long-term application, turn off the TENS unit and remove the electrodes and give your skin a breather. For further warnings and precautions, read your instruction guide included with your TENS unit. Without further ado, let's get into it. So the first thing you want to do when you get your TENS unit is flip it over, slide the battery cover off, and insert two batteries. After you get those inserted, slide the battery cover back on the TENS unit. Your TENS unit should come with two nickel batteries that are rechargeable and a battery charger. Make sure your batteries are fully charged before using your TENS unit for any extended period of time. Step 2 is to insert the lead wires. Here you will see two ends of the lead wire. Enter the smaller, thicker plug into the top of the unit. If using one lead, plug it into channel 1 on the left of the unit. If you're using two leads, plug the second one into channel 2 on the right. Next, let's attach our electrode pads. Go ahead and remove them from the Ziploc bag and pull out a set of two. If you're using two leads, pull out both sets of two. Go ahead and insert the lead wire into the electrode insert to connect the leads. It does not matter which color goes into which electrode. Step 4, let's place the pads on your area of pain. Wherever you place the pads, make sure the skin is clean and thoroughly dry. Body lotions and oils can prevent the pads from sticking to your site of pain. Always make sure the TENS unit is switched off before attaching and detaching the pads. Once you have everything in place, let's turn on our unit with the orange button on the right. If the LCD display does not turn on, check the way your batteries are inserted or swap out your batteries completely. You will find some arrowed buttons with abbreviations on them. The PR arrows on the left stand for pulse rate, and that is how frequently you feel the electrical sensation. Typically, increasing the pulse rate increases the comfort of the treatment. On the right, you will find PW arrows, which stand for pulse width, and that is the duration of each electrical impulse. Increasing the pulse width increases the area of sensation as well. In the middle, you will see a mode button. The three modes you can toggle through are constant, burst, and modulated. Constant mode provides constant stimulation at your desired frequency and pulse width setting. This is commonly used for acute pain relief. Burst mode is a heavier kind of mode that is used in producing muscle contractions or giving an acupuncture-like stimulation. Burst is useful in chronic pain relief. Modulated mode cycles between high and low parameters. Tolerance with modulated mode is usually delayed and can increase analgesic effectiveness. When all of these settings are finally in place, you can quickly push the orange power button to lock in your settings and put the front cover back over the control buttons. On top of the TENS unit, you will find two knobs for the respective channels. Since channel 1 is on the left, I will use the left knob to turn it on and turn up the intensity of the electrical stimulation to my desire. Here you will see the application of two sets of electrodes on somebody with low back pain. TENS electrodes should be placed around the perimeter of the area to be treated in order to be effective. This allows the current to travel through the nerve fibers within the affected muscles. You can arrange the electrodes in lines, in X formations, or in squares, but try to place them 1 inch or further apart. To make an X, place one pair of matched red and black electrodes for one diagonal and another pair for the crossing angle. You will notice Dr. Connor turn up the knobs on the TENS unit to increase the intensity of the respective channel. In addition, he presses the clock button under mode to set the duration of the treatment. Once a strong, comfortable sensation has been achieved and a desired time has been set, press the orange button to lock in the settings and flip the front cover shut. From there, you can lay the TENS unit next to you or clip it to your pocket if you are on the go. If you are driving, please refrain from using the TENS unit while operating a vehicle. When you are done with your TINS treatment, flip the front cover back open and hold the orange button down to turn off the TINS unit if it is not already off. If the treatment duration has been achieved, the TINS unit should shut off automatically. From there, carefully peel off the electrode pads and place them back on the cellophane cover they came in. Try not to pull on the lead wires to take the electrodes off your skin. Pulling on the cord and not peeling the electrode can damage the lead wires of the unit. After all the electrodes are off, remove the lead wires from the inserts and place the electrodes back in the Ziploc bag. If you have any further questions or concerns on how to operate a TINS unit, ask your doctor or a healthcare professional. I hope you find this tutorial helpful, and as always, thank you for your service.